So whenever you wanted to apply the needle, please don't apply like this. Don't apply needle pericardium 3 like this. This is the wrong procedure. What you should do, first always use semi-flex. First you should do semi-flex your elbow. Semi-flex means half elbow. This how much degree? So now you try to find out when you tendon. Which tendon is it? Now we try to find out the cubitus tendon. So tendons on the medial side in the depression. Which muscle is it? Brachialis muscles. These muscles called as a biceps muscle. These muscles called as a brachialis muscles. We try to find out the location while giving the pressure. Once you give the pressure, all of you in the Zoom, I recommend you, please you just fold your sleeves and then try to find out on your own body, because you can find out from yourself. Here physical class, all of you try to find out where exactly, and then mark it in your pen as well. You just show me if you have any doubts, right? Now just palpated is the tendon in the depression. Next to the tendon in the depression, I just apply the perpendicular needle exactly on the downwards direction, where exactly there is a 25 mm needle. The deep has been gone inside. That means the 1 cho needle entered to the deeper level. Now we try to find out, and we should give mild stimulation to this point as well. Now there is a very deeper level. Which artery is located? Brachialis artery is existing inside of the deeper muscles. Now the pericardium 3 is the grandmother point of the pericardium, and also C point of the pericardium as well. C point of the pericardium. So therefore once we applied this point, so that means strengthening or regulating or promoting energy to the pericardium meridian. Whenever there is a brain cheese deficiency or the brain fog normally says, I do have the amnesia related problem where the vision, the memory is not good. There is a poor memory. Anything connected to that brain related condition need to be activated. Remember, this point is very, very useful to treat for the many more indications. By the way, the pericardium 3 also useful to treat for the gonads as well. Gonads means is the ovaries and also testicles. Anything problem related to the gonads and testicles, having ovulation related problem, fertilization issues, testosterone level related problem, and further it is related to the penile organ or maybe the testicles where the sperm production is not too good. In that situation also we can use the pericardium 3. Pericardium 3 also is the wonderful point. You remember, is the key information is whenever the patient feels there is a migraine headache or any kind of the headache, remember when the pericardium is deficiency on the pulse diagnosis, where exactly there is a pericardium also to be known as a kidney yang deficiency, not the kidney indeficiency. In that perspective, we wanted to tonify this point. This will be really helpful to treat for all the migraine related disorders, right? Whenever there is a half headache or the whole headache, that time we can selectively use this point. Normally headache people will get, what could be the reason? The person who don't get the fever for the last 2 years, but the people are very happy. Oh, I don't have the fever for the last 10 years, I don't have the temperature. That indicating perhaps you do have the migraine. So migraine is heat and cold need to be balanced in our body. So that time heat get flares up whenever you apply this point. But most of the time, sometimes may get the temperature as well. When the temperature gets as a mild to moderate level, that indicating the heat and cold is balancing in your body system. So once it elevated the heat, then you remember the circulation of the brain, the basilar artery, cerebral arteries, communicating arteries, all are will going to improve the circulation in that region. So therefore the headache also will get minimizes. Where the sodium and potassium ions are circulating, that also circulates precisely, and the waves which is alpha, delta, gamma, theta waves which is passing on the brain system directly, indirectly, will be helpful by using this point. Remember, because this is given the life to the patients as well. Whenever at the age of the 70, 80, 90 years, remember, at the age of the 90 years, people who are suffering for the low energy always, low energy on the region which we call as a vertigo, giddiness, fatigueness, lethargy, amnesia, numbness, cool, hands are very cool. In that situation, remember, where the neurojunction is not precisely taking place, in that particular situation, pericardium 3 is treating to giving the life to the, see, what I strongly believe is, but I don't see that maybe this side, that side. In some situation, normally I need to recognize paralysis is there, then I need to apply on the opposite side would be better rather than same side. In that way I recognize. But you keep it in the mind, whenever there is a you recognize that pericardium chi is deficiency, that time you just apply this point randomly. Pericardium is deficiency, you just use the pericardium 3. Only one place you just apply, anywhere, either right or left. That will going to work. But still you need the gratification. You wanted to apply both the sides. No problem. You can use it because the meridians are existing bilaterally. Isn't it? But unilateral, that also works. Because my intuition says that, yes, I selected is the right point. So, ek maar do tukde, people says, like that this point also works wonderfully whenever there is a problem related to the migraine or the pericardium is deficiency. The people who will get this problem, you recognize polyuria. Normally says, because water is excessive. Normally, whenever there is a pericardium deficiency, cross-check with them. Since how long do you have the headache? Since how long you have the fatigueness? Since how long you have the numbness conditions? Then those people will tell you, yes, I do have the problem, numbness I do have, the coldness, chillness is there. By the way, they says I have the polyuria because the coldness is dominating, excessive urination in the night time, sometimes excessive urination in the daytime as well. So in that particular situation, you need to be activated pericardium 3. That always is good because the coldness get minimizes, the fire get increases, the coldness get decreased. That means is the polyuria, frequency of urination, dribbling of the urination, urgency of urination, prostate gland related problem, that have some kind of the changes in that. In that way you feel the more energetic by activating this point. Now number.
Sir, excess heat and fatigueness both at once if person has, we can use this one.
Fatigueness?
Excess heat, brain fog and fatigueness if it is together.
Yes, you can use it that time because when the excessive heat is there, that time we can use the pericardium 3. Yes, you can use it. Remember, acupuncture, whenever there is energy is required, that will going to receive. When it may not be required, again we apply the needle, that gets the neutralizes, because that is the positive and the negative feedback mechanism will going to work in the body system.